It is that time of year again. Spring is upon us for about 40 million Americans. It also means dealing with dreaded allergies. But don't worry, early show medical correspondent Dr. Jennifer Ashton is here with the best ways to get those allergies under control this time of year. Good morning. Good to see you.
Good morning, Chris.
So what is the deal with allergies, and why is it this time of year where they always seem to kind of creep up and be the worst?
Well, it can really be any time of year, but you're right. Spring, fall, the peak seasons. Basically, when you think of allergies, what you want to think of is really a hypersensitivity or hyperstimulation of our immune system. And where we see it the most is our initial barriers to the environment, the mucous membranes, eyes, nose, throat, and then if really severe, chest, lungs, upper respiratory system, and really can be a serious issue.
Yeah. I mean, are they genetic or can they develop? I mean, I know personally, I grew up with dogs, and I'm talking about like golden retrievers, dogs that a lot of hair. Exactly. And I was fine, but as soon as I hit 24, now I can't go anywhere near them.
And similar with me, I developed them when I was in high school. The answer to your question is can be both genetic and they can develop later in life. Most people can develop them in their childhood, young adulthood. They can pop up in the adult years as well. But if you come from a family where one of your parents or siblings is prone to seasonal allergies, and the medical term is allergic rhinitis, your risk is therefore higher.
Okay, what about some allergy triggers that are out there?
Listen, when you think about our environment, it's really anything that you might be able to see or in some cases can't see. So you're talking about tree pollen, grass, weeds, dust, pet dander, mold, anything really that can be circulating in the air or in particulate matter can trigger these allergic symptoms.
Yeah, and as far as getting them under control, I know it's probably easier said than done, but there are a number of different ways people can kind of go about this.
There are, Chris, and when I talk to my patients, it's shocking how many people are not treating them well and not optimizing their treatment. Basically, you want to start by getting control of these symptoms early. It's much easier to treat the allergy problem before they're full-blown attacks. Then you can go to over-the-counter treatments, nasal sprays, decongestants, or pills. But you need to remember, Chris, these are really only good short-term or sporadic use. If they don't work, then you really need to go to prescription medications. Then you want to control your environment. So if possible, minimize your time outdoors during peak pollen hours. Use a mask if necessary, things like air conditioning. And then you can try things like natural remedies. That neti pot, which has been in the news recently, can be effective. Also, short-term remedies. Lastly, if none of these things are working, you want to see a physician, an allergist, who can go through desensitization injections early. Preferably you start this in the winter so that by the time the spring comes, you're really in control of these symptoms, and they can be effective. But it is shocking, Chris, how many people don't take the right medication.
Yeah, and what is it about allergy medication that I know there's non-drowsy and things like that, but you always do feel a little bit different when you take it, even the quote-unquote non-drowsy.
There's no question. Those are antihistamines, and even if they are non-sedating, their job is really just to dry up all of those secretions. My preference, and really the gold standard, is something called a leukotriene inhibitor, brand name Singular, which prevents those from starting in the first place. So really, if you're not getting relief short-term, speak to your doctor.
All right, Dr. Jen Ashton, thanks. Good to see you again.